So today we're going to be talking about oral health and, the oral hygiene year round. So can you tell me kind of about your daily routine when it comes to your oral health?
My daily routine, basically I wake up in the morning and I brush my teeth and I use mouthwash, and then I brush my teeth a couple times a week after work, after I shower, and I use toothpicks all the time.
Okay, yeah. So you definitely should be brushing your teeth morning and night every single day, not just a couple times a week. At least, some people do it more, but definitely at least that twice a day. So about how long do you brush your teeth for?
I think I remember once as a kid, the dentist said I should do it for like 20 seconds, so I was trying to hold around that, somewhere 20.
20 for your whole mouth?
That's, it was years ago, so that's just kind of what I remember. It's probably wrong at this point, but
Yeah. So we actually recommend that you brush your teeth for 2 to 3 minutes, about a minute to a minute and a half on top, and then a minute and a half on the bottom.
Well, I'm way wrong.
Yes, definitely brush your teeth a little longer. Can you demonstrate for me on this model how you would brush your teeth?
I guess just kind of back and forth on the tops and bottom, and I always like to try and hit the backs of my teeth every once in a while, when I brush, because it's not just the fronts.
Right, for sure.
And then my mom always told me as a kid to make sure I use circular motions when I'm doing the front surfaces of my teeth.
Yeah, that's great. Yeah. So when you do brush your teeth, I really liked your point about those, the small circular motions there. We recommend that you kind of angle your toothbrush up like 45 degrees or so to make sure that you're getting those gum tissues when you brush. Yes, definitely get those tops and bottoms, your chewing surfaces. A lot of food likes to hide, especially in your molars back there, so that was really good. And then, as best you can, try to angle your toothbrush, the 45 degrees for the back side also to make sure that you're getting that gum tissue. About how much toothpaste do you use?
I remember a show when I was a kid that told me that I should use a pea-sized piece of toothpaste, because too much is a waste of money and too little is not doing enough.
Good, yeah, that's really good. That's what we recommend also. When you brush, do you get your tongue?
Yeah, I try and do that every day. Sometimes I might forget, but I do.
Okay, so when you're brushing that tongue, how would you do that?
If I'm not doing circular motions, I always try and either go back and forth and front and back, just to try and disturb everything on my tongue before I rinse my mouth.
Okay, great, yeah. When you're brushing your tongue, just make sure you don't brush too rough. You want to kind of do gentle sweeping motions, and you want to go as far back as you can go, obviously without gagging yourself. I don't know if you know this, but actually the bacteria on your tongue can be a cause of your bad breath. I know you mentioned you used toothpicks, which is good. That does help disturb your gum tissue. Do you ever floss?
Not really a big fan of floss.
No? Okay. Well, can you kind of demonstrate to me how you would floss if you did on this model?
I used to when I was younger. Mom made me do things all the time, so I don't know. You just take the floss, and I always just try and get in between my teeth. You gotta get down in there, down to the gum line, and then on some teeth I try and make a little U and get on both sides and like wiggle to the backs of them and stuff, so I can make sure I get all of them.
Yeah, that's great. When you do hold your floss, we do kind of recommend you do either your ring or your middle finger and kind of wrap it around lightly, obviously, so you don't cut off the circulation to your finger. And you want to wrap it more on one side than you do the other. But then you'll wrap this other side, so you have about an inch left, and you'll use your index and your thumb to kind of help you get in those spaces. So what you're going to do is you're going to lightly kind of like wiggle it between your teeth until you feel that resistance. And you want to do C shapes back and forth on both of those sides of the teeth. And you'll come out, and you'll take that dirty part and kind of wrap it around this finger, and then unwrap a little bit of this one so you can do the next ones. I know sometimes it's harder to get back to those molars. I have a hard time also. So floss picks are definitely really great to use. And then when you're flossing, you want to make sure you get as far back as you can go. Obviously, you want to get that gum tissue back there. I know a lot of people have a hard time kind of reaching those harder to reach places, but just as far back as you can go.